What were you trying to solve when you joined NOCD as a CCO, you think?
There were a couple of things that were going on there. There was number one, a drive that I saw in Stephen, our CEO, to really change the way mental health is delivered in the world. And I thought, once in a while you meet people or you see people, you hear people on TV. You've got all the big people you see sometimes, the visionaries, and he seemed like a visionary in a way of what he thought about healthcare and the way that he wanted. We got into Forbes 30 under 30 even with this idea of doing this and everything. And so I was really excited by that, and I liked the passion. And there was also a personal side too, because as I had said earlier, I was driving 3 hours a day, but my wife was dying of cancer at that same time. And there was an opportunity to be able to be more at home and be more helpful to her and help coordinate things better, because every time I went away to work every day, I had to make sure that if there was an appointment, who could take her to the appointment, because I was working and I only had so many days off and everything. But I was able to sit down with Stephen and say, listen, here's what's going on in my life, and here's what you'll get from me, and I will give you everything. But there are times that I'll be in the car doing a meeting, or in the waiting room of a hospital, or sitting at a restaurant booth or something, because I have to take her to her appointments and chemo and radiations and all of those things too. And so it was a mutual, yes, we're going to do that together. And so they were very helpful to me to be able to spend the last few years of her life more at home and not so far away. And in return, I kept my promise, and I just, whatever we needed to do, we did to get this to grow and grow. And when I joined, we had 18 therapists, and today we've got over 800 therapists at NOCD. So it's really great.
Wow. One, I mentioned it offline, but for people to know, sorry for the loss of your wife. And when you think about the sacrifices you made, the risk that you were taking as well, right? From going in something that was probably comfortable to saying, hey, I'm willing to play alongside with you. I see the vision. Let's do this together. What did it mean for the mission to be recognized by Forbes 30 under 30?
I mean, that was great that people were seeing that what we were doing wasn't just some weird idea, right? And it wasn't just a pipe dream or something like that. It gave a lot of legitimacy to the fact that we were trying to be an agent of change, right? And so as we've gone through our growth, and it's been amazing every day to see the dedication of the team that I get to work with, who constantly are trying to push the envelope or to ask questions. One of our values at work is egoless questioning. And so we're always asking questions of each other about, well, but why does it have to be done that way, right? And how can we come up with a different way to do it that will work and is, within the bounds of the way you have to do things done, but still is a new view on it as well. And that's always exciting to see what we can do to grow and give more people opportunity for health and care.
And what do those goals look like when you talk about growth? Let's talk about the next 5 years. I always like to see if we can kind of speak things into existence. What does that look like for you?
Well, we like to say our goal is to help solve the mental health crisis in the United States, right? Now, that doesn't mean that there won't be mental health issues, but what we feel that means is that people will have access to evidence-based care, know where to get it and know how to get it, and there will be delivery systems that will be very efficient in providing it. And so that's what our goal is. And we're starting that with obsessive compulsive disorder and related conditions, and we'll see where we grow it from there. But we continuously are trying to, just figure out new ways to make it happen. One of my favorite examples is we were using electronic health records that were kind of out of the box, right? That we were paying subscriptions for. Yep. but they were never quite doing everything that we wanted them to do. One of them would only schedule in central time zone, but we had people in all the time. So then we'd have to be like, okay, so that's 2, but that's central. So remember that's 12 your time, but I'm on the east, and it was a nightmare. And I remember, and a group of us, we were here in my basement, and we made a phone call to this company, and they said, well, it's going to take us about a year to do it. And our chief technical officer, he said, I'll have it done in 2 weeks. And we built an electronic health record in 2 weeks for ourselves, literally in this basement with me sitting here at my laptop, and they'd build something. They'd say, try it. And I would try to break it. Right. And I'd be, I cracked it. They'd be, okay, what happened? And they'd go back and they'd be like, blah, blah, blah. And then, so we went from having to conform to other people to say, no, we're not doing that anymore. We're done with that. We're going to build something that's right and that's good and that actually works for us and for what we see is needed in the mental health community. And that's what we did. So that's the kind of stuff we do.
I mean, you're in the space of, you were, kind of almost in corporate, I would say, for a very long time. You get into a startup. Were you always in a...
I was in hospitals for almost all of my life. My career was almost always in hospitals. Yeah.
So when you became I would say you became an entrepreneur, right? You started this with the startup. What is your thoughts on it, man? After being in that space for so long and then coming here, how did it feel for you?
We joke that trying to get something changed in a hospital is like trying to move an aircraft carrier down a side street, right? But. Yep. Working at a startup, you're on a speedboat and it can do 90-degree turns in a second. And so that's what was just amazing was I didn't have all the red tape and stuff that I love that. I could do things faster and quicker, and you didn't have to pass it through 12 levels of committees to get an okay to do something. It would be like, yeah, that sounds good. Why don't we work that? And so it's been really great. And I think why we've been able to expand so much is that we've tried to not have all those layers of approvals and reviews and everything like that. I mean, we definitely do review things and make sure they work, but it's not redundant so much like you have at very large corporations,